This video is about the different consultation models that exist and how they can be used. Welcome to Consultations for Health, helping you progress in your communication skills to optimise the care of your patients. Over the years, as healthcare has developed, different consultation models have emerged or old ones changed to meet the changing needs of the healthcare environment. A consultation model is purely a framework or a guideline of how to conduct a consultation. It is not essential that practitioners follow existing consultation models to the letter, but they are there to help guide, give structure and provide content for what should be included. Using a consultation model can help develop your consultation skills and give you a tool to provide feedback. It is important to note that it is not one size fits all, and you do not have to follow a set model when conducting your consultations. You should create your own style, which may include elements of different consultation models. Consultation models started in the 1800s, and since then numerous models have been developed. This video will take you through some of the different consultation models. The biomedical model is probably the oldest consultation model that exists, and it's from the 1800s. It's a model that purely focuses on investigating a problem scientifically, working through a diagnosis using tests and examinations, and then deciding on a treatment for the patient. There is no real involvement of the patient and their psychological well-being within this model. In the 1950s, Balint Theory was developed. This was the first model that made the connection between a patient's psychological well-being and emotions and their physical manifestation of their symptoms. This has been the basis for the development of the doctor-patient relationship, and it more than being just a physical action of trying to treat someone's ill health. In other words, the patient's physical symptoms, their emotional well-being and social factors are all inseparable. This model also makes reference to the doctor as a drug and the role the doctor can play in their behaviours in the consultation to improving the healthcare outcomes of their patient. This model is still very practitioner-led and doesn't make reference to a clear structure or how to conduct a consultation. Through the 1950s, the role of psychology and understanding patients' behaviour started to fully develop. The health belief model is not a consultation model per se, it is a psychological model that tries to understand why patients will carry out health behaviours. This model recognises that everybody is an individual and patients don't just blindly follow the instructions given to them by their doctor. We need to consider the varying demographics of our patients and truly understand how they perceive their illness and the seriousness of that illness, and what they think of the recommended action they've been given, whether they think it has benefits to them or there are significant barriers that they would need to overcome. By understanding these wider range of factors of the patient's view of the world can help a practitioner to support their patient more effectively. This model, however, does not really provide a consultation structure. It provides the principles to understanding the patient's view of the world. In the 1960s, another psychologist, Eric Berne, described 3 ego states that practitioners and patients can be when conducting a consultation. These ego states describe the feelings and nature in which someone wishes to communicate, and they can vary between a parent, a child, or an adult. The adult state is when we are behaving logically. We consider information given to us and we provide a sensible, calm response to that information. The parent state relates to how a parent may talk to their young child. it is characterised by two sides. The authoritative, domineering state in which you would be telling or wagging your finger of a young child what they should be doing. The other side is the caring, nurturing side of an adult. For instance, when a child falls over and hurts themselves. This is the parent who puts their arm round them, supports them and says, there, you'll be okay. The child state, much like the parent state, fluctuates between two clear characteristics. The one which is obedient and submissive, following being given instructions by their parents, or the rebellious, emotional child who is very upset, runs off and bangs their feet in the corner. Eric Berne states that a consultation, or transaction as he refers to it, as information is passed between two parties, works best when both parties are acting as adults, logical, calm and composed. Transactions are less effective when parties take one of the other ego states, such as an adult talking to a child, or a child talking to an adult, or a parent talking to a child, any combination that is not adult and adult. When both parties are in the adult state, the patient can be independent and responsible for their own care. This represents a more patient-centred consultation approach. This video has covered some of the consultation models that were originally developed before the 1980s. These models have set the basis for how we conduct some consultations today. Look out for our video on more modern consultation models in the future. I would just like to thank my PhD student Hayam Al-Jabbar for our hard work in pulling together some of the literature on consultation models. Thank you for watching Consultations for Health. Don't forget to follow us on Twitter, like our Facebook page and subscribe to these videos.